Okay, at this point, let's discuss about the concept of your potassium. Potassium is actually one of the mostly asked questions both in your PNLE and your NCLEX. And when it comes to potassium, of course, just like all the other concept posts pagdating sa ating med-surg or adult health nursing, remember and always remember this one: never panic whenever you are asked of these concepts. Why? Because it's just a matter of up and down. Taas baba lang po ang mga concepts dito. Okay? So, now at this point, let's first discuss about the concept of your hypokalemia. Okay? Write it down, hypokalemia. Well, we all know that the concept of hypokalemia or hypokalemia as a condition happens when there is a serum potassium. Okay? You write it down. The serum potassium is below. Okay? Serum potassium level is below or lower. Okay? Lower than. Alam natin yan. Okay? So, there's actually, when it comes to your ranges in your normal values, nagkakaiba-iba. But when it comes to your potassium, it's always precise. So far, wala tayong nakikitang higher than. Okay? So, hypokalemia is a condition wherein your serum potassium is lower than 3.5, okay, milliequivalent per liter. Okay, you know what? When we say milliequivalent and when we say hypokalemia and when we say potassium or serum potassium level, this is one of the most common mistaken concept of our student nurses and those who are about to take the PNLE. So I'll be explaining this one very shortly to you guys. So whenever we think of your potassium, most of the students always think about the bloodstream, because we all know that your potassium is an intracellular cation, and that's true. Okay, that's actually true. It's a positively charged electrolyte, and then saan to mas marami or saan siya nagre-reside talaga, it is actually located inside the cell. So it's the most abundant intracellular cation. So ibig sabihin positively charged siya, and then saan siya nakalodged, majority of your potassium are actually located inside your cell. That's why it's cation. It's the most abundant intracellular cation. So, however, when it comes to your serum potassium, we are actually talking about, okay, so this is the cell. Okay, so this is the cell. Remember this, what we're trying to depict here is just for the sake of illustration. Okay, so example. So for this example, most of your potassium are actually inside the cell. Okay, nasa loob yan ng cell. That's why it's the most abundant intracellular cation. Now, however, there is a certain amount that's also outside the cell. That's why meron siyang tinatawag nating extracellular. So saan siya nakalodge? It can be lodged in your extracellular spaces. Okay? So yung mga extracellular spaces natin, okay? It can also be lodged inside your bloodstream or your blood vessels. So we call them, of course, the intravascular spaces. Okay? Such as, say, for example, your blood. It's located intravascularly or nasa loob siya ng ating blood vessels. Okay? So, for this condition here, okay, what happens to your potassium is that yung normal po na 3.5 to 5 milliequivalent per liter is hindi po normal at this time. Okay? So, bumababa siya. Okay? Lower than 3.5. So, what's allowed inside the bloodstream is the 3.5 to 5, okay, milliequivalent per liter amount of potassium. So, this is the reckoning point of everything. Ito yung nakakalimutan ng estudyante because when they think of potassium, they immediately think of those that are located inside the cell. No. And that's a wrong connotation. So, whenever we think of potassium and it is asked whether hypokalemia or hyperkalemia, the reckoning point should be the bloodstream, because hypokalemia and hyperkalemia can be assessed through the extraction of serum or the blood itself, which is coming out from your intravascular space. Okay, so this is the this is an eye opener, and perhaps one of the things that have just settled all the questions in our minds and entanglement that we are maybe having in our minds. Okay, so again, serum potassium of lower than 3.5 milliequivalent per liter. So the condition now is your hypokalemia. Okay, so of course, we know that talking about your hypokalemia, the most important thing that we should be thinking now, because we know that it's lower 3.5. Okay, it's lower than 3.5. Alam na natin yan. So now, moving on, we need to think of what have caused. Okay, what are the possible causes now pagdating naman sa ating hypokalemia? And pagdating po dito, isa lang yung dapat nating isipin. So, hypokalemia, it's lower than 3.5 yung ating potassium levels in the blood, not in the cell. Again, it's in the blood. So, lower than 3.5 po ang ating potassium sa ngayon. So, ano yung nangyari? Okay? Alam nyo, ganito lang. Kapag may nawala, ibig sabihin, kapag bumaba yung level, okay, ibig sabihin nawala, posibleng kulang lang. Okay? Di ba ganun naman, kapag may nawawala or kapag bumababa, ibig sabihin, just like your normal ways of life. Okay? So, kapag may nawala, could be may umalis, may nawawala. Okay? You could have misplaced something. Okay? Ganun lang. Okay, so, it's the same with the concept of your hypokalemia. In your hypokalemia, okay? So, in your hypokalemia, the causes are just enumerated actually into 4. First is that there is a loss of potassium. Alam natin yan. So, simple lang. Bumaba yung potassium, okay, probably may nawala. Okay? There could be a loss. Yan. So, that's an example. Okay? So, that's one cause of your potassium. So, pangalawa, of course, kung may loss, this is the actual loss, no? Talagang nawala. Okay? Of potassium. Number 2 naman, this is now the lack of potassium intake. Yan. So, probably, hindi naman sa totally nawala, pero kulang lang. So, ito yung ibig sabihin sa number 2. Okay. Now, let's proceed to your number 3. Number 3 naman, na cause of your hypokalemia is what we call, ito yung concept, no, na we've known before, or alam natin to. However, na-realize lang natin after I have explained to you that the reckoning point for your potassium levels, okay, in your hypo or hyperkalemia is the bloodstream or the blood vessel or the blood, okay, not the cell. So now, dito, okay, another cause is the shifting, okay, the shifting of potassium, okay, the shifting of potassium from your, okay, from your ECF, which includes your blood vessel. Okay, alam natin, sinabi natin kanina, kapag sinabi po natin extracellular space, all of those spaces outside the cell. So, ang bloodstream or blood vessel, that's outside the cell. So, ngayon, ang nangyayari dito sa number 3 is nagkaroon ng shifting. So, yung potassium na 3.5 to 5 milliequivalent per liter, that's only allowed, okay, in your bloodstream, nawala pa. Okay? So, shifting of potassium from ECF to ICF. Okay? So, ngayon ang nangyari, bumaba sa bloodstream yung level po ng ating potassium kasi napunta sa cell. Okay? So, mas dumami pa sila sa cell. Okay? So, ngayon, you know what? We need to maintain the normal amount of 3.5 to 5.0 milliequivalent per liter amount of potassium in the bloodstream, because that's the normal amount that's allowed in the blood. Ang tawag po natin doon, pinag-aralan natin to sa ANAPHY or your anatomy and physiology. That's what we call as your homeostasis. Okay? Para po magkaroon ng homeostasis, okay, in between your intracellular and then your extracellular spaces. Okay? So, number 3 is shifting of potassium from ECF to your ICF. Now, number 4 naman po na cause of your hypokalemia is this what we call as your serum dilution or dilution. Okay? Serum dilution. Simple lang dito, class. Okay, kapag sinabi po natin serum dilution, halimbawa yung blood natin, no? In the blood that's located in the bloodstream. Okay? Normally, the consistency should be yung comfortable for the blood to survive. Kasi kapag naman magkaroon tayo ng halimbawa, it is affected by temperature, it is also affected by the other components that's located in your blood, halimbawa in your hyperglycemia in the case of your diabetes. So nagiging mas malapot, nagiging mas viscous yung ating blood. So dito sa inyong number 4, one of the causes of your hypokalemia is that yung ating pong dugo ay nagkakaroon ng hemodilution. Okay? We call it serum dilution. Okay? So anong ibig sabihin? Mas dumami po yung fluid. Okay? Now, ibig sabihin, nagkaroon tayo dito ng tinatawag nating dilution of serum potassium. Okay? So mas dumami po yung fluid na probably are making our potassium to be of lower than normal levels. Okay? So this is such as say for example yung mga IV solutions of deficient solutions. Okay, so now you may be asking, sir, saan dyan yung ating Cushing syndrome? Sir, saan po dyan yung ating alkalosis or yung hyperinsulinism? It's because I've heard, sir, that it really can cause your hypokalemia. So the answer goes this way. So ito po yung ating generic na mga causes, and whenever you are entangled, so just remember this, okay? 4 words, LLSS, so loss of your potassium, lack of potassium intake, the shift of your potassium from ECF to ICF, and of course, okay, serum dilution. So now, sir, uulitin ko po yung tanong, saan po dyan yung ating other cases? Okay, so now, it would fall on every condition na meron po tayo dito, okay, sa ating pong enumeration na ginawa. So now, let's try to explain this one further here. So, in your first point or your loss of potassium, so bakit nawawala yung ating potassium? One of the most common cause, one of the most common cause of your actual loss of potassium could be the use of your, sulat po natin, the loss of your or the use of your drugs or medications. Okay, so maybe nagkaroon tayo ng paggamit ng mga medications po. That's why nagkaroon tayo ng actual loss of your potassium. So what are these medications? So such as say for example, your diuretics. So which could be your diuretics. Ano po yung mga diuretics natin? Ito yung mga tinatawag nating potassium wasting diuretics. So again, potassium wasting diuretics. And when we say potassium wasting diuretics, tandaan lang po natin, this is a very important note here. Okay, tandaan natin that your thiazide, isulat po natin, that your thiazide throws, okay? That your thiazide throws or tinatapon. Okay? Your thiazide throws potassium. Okay? Again, your thiazide throws your potassium. Okay? So that's a very important note there. So also, another medication na pwede rin maging cause of actual body loss of your potassium could be your corticosteroids. Okay? Corticosteroids. Okay? Yung mga steroids po natin, this is an example po of medication that can cause the actual body loss of our potassium. Okay. So another, may isang famous tayong condition here that can also cause your actual body loss of potassium, and that's what we call as your Cushing's syndrome. Okay, Cushing's syndrome. Well, alam natin to. Okay, so when we say Cushing's syndrome, this is a problem in your endocrine. Okay, this is part of your endocrinology nursing, wherein ang problem po natin sa ating Cushing syndrome, why it can cause your hypokalemia, it's because in Cushing syndrome, there is an hypersecretion or increased secretion of a hormone we call aldosterone. Okay, so when there is an increased secretion of aldosterone, so of course it can cause now the total body loss of, or the actual body loss of our potassium via the excretory system through the through your kidneys. Okay, so that's another factor that can create the actual body loss, okay, of your potassium. So other causes can actually also cause potassium, such as, say for example, your vomiting. Alam natin yan. Syempre kapag nagsusuka ng pasyente natin, okay, there could be an actual potassium loss. Others also may follow, such as, say for example, your diarrhea, and of course your wound drainage, your gastrointestinal or nasogastric suctioning. It can also cause your body loss of potassium. Okay, so basically those are the things of most important nursing considerations or concerns and the cues, okay, or the causes of your potassium. So now let's discuss, when do we say that there's a lack of potassium intake that may also lead to hypokalemia. So, ang very common po dito, no, yung mga pasyente po natin na nagda-diet, okay? Yung mga nagfa-fasting, okay? Or yung mga pasyente po that are at NPO, okay? They are very at risk of having the condition of your hypokalemia, okay? Again, hypokalemia, or simply as your malnutrition, okay? Halimbawa, yung mga pasyente po natin na malnut, okay, may mga nutrition imbalances, okay, so lower than normal limits. So this puts the patient at risk of acquiring or having hypokalemia. Okay, so tandaan po natin yan. So dito po, another cause is also the shifting of your potassium from your ECF to ICF. Again, uulitin po natin na ang reckoning point po natin pagdating po sa ating potassium, it's not the cell, but it's the blood vessel of the patient. Okay? So, ang blood vessel po ng isang tao. So, again, ang nangyayari dito is nagkakaroon ng shifting or nagda-transfer po yung ating potassium that's allowed of 3.5 to 5 limits in your bloodstream. Nagta-transfer po sila sa loob ng cell. So, ano ba yung mga condition that can lead to this one? So, meron po tayong dalawang pinaka-famous dito. Okay, number one is the condition of alkalosis. Okay, alkalosis. Tandaan po natin yan, that alkalosis leads to the shifting of your potassium from the bloodstream, okay, going inside the cell. Okay, so alkalosis. Another also is your hyperinsulinism. Okay? Hyperinsulinism. So, ibig sabihin kapatid, okay, in your hyperinsulinism, okay, so mayroon tayong mataas na level po ng ating pong insulin. Okay? In the body, which is created by your pancreas. Okay? So, ngayon, tumaas po siya ng tumaas lalo. Okay? So, such as say, for example, in your condition of your pancreatitis, okay, also in your diabetes mellitus, wherein your cell receptors doesn't consider or doesn't or yung nagkakaroon ng malfunction po sa receptors po ng ating cell of insulin, because the cell cannot recognize anymore insulin, okay, together with our, of course, glucose. So now there could be a shifting of potassium from ECF to ICF on these conditions. Okay? So, alkalosis and then hyperinsulinism. Another also, kapatid, is that pwede rin magkaroon tayo ng hypokalemia because of delusion. So, again, kapag sinabi po natin delusion, simple lang. Okay? So, when we say dilution, in our local language, we call it lapsaw. Mas lumapsaw po yung ating pong serum or yung ating pong blood. So this can be caused, of course, by two major reasons. Number one is your through water intoxication. Okay, through water intoxication. So alam natin yan, no? So when we say water intoxication, there's too much fluid or water, okay, inside the body. So this can also be known as your FVE or your fluid volume excess or your overhydration. Okay, pareho lamang po ito. So another also is your IV therapy. Okay, IV therapy. Okay, so nagkaroon din tayo ng fluid volume excess due to IV therapy, okay, with potassium deficient, okay, yung mga potassium deficient na mga solutions. Okay, so this is a problem now. So gumamit po tayo ng IV therapy, okay, or IVF or IV fluids which has your potassium deficient solution. So that could be one of your causes of your hypokalemia. Okay, so basically these are the major causes of your hypokalemia: the loss of potassium, lack of potassium intake, shifting of potassium from ECF to ICF, and of course your serum dilution. Okay, so kapag makalimutan po natin to, let's all go back to the mnemonics po natin, LLSS. Yan. Okay? So, loss, lack, shifting, and of course, the serum. Okay? Anong nangyayari sa serum? Nagkakaroon po tayo dito ng dilution or dilution. Okay? So, now, let's further discuss this one. Let's move on to your positive or your... What are the assessments that can be found in your hypokalemia? Okay. So, when we talk of your assessments in your hypokalemia, okay, so may mga konting bagay lang, no? Actually, few things lang po ang dapat nating matandaan dito. Okay, so let's discuss about the assessments. Okay, assessments of a patient, or simply this talks about the signs and symptoms. Ano ba yung makikita natin sa pasyente natin, no, na mayroong hypokalemia or in a state of hypokalemia. Okay, so basically, isa lang yung tandaan natin. Okay, this has also been mentioned by Raymar in your NCLEX, and of course, nag-agree din dito mga references natin like Saunders, like also even in Archer Review, no? So also in our local resources in the Philippines, so they all agree into this thing. Okay, so in our hypokalemia, okay, in our hypokalemia, tandaan lang natin to that all are down. Remember this one. Okay? All are down. All are down po pagdating po sa ating pong pagdating sa ating hypokalemia. Okay? So, however, except, okay? Meron tayong ditong exception. Okay, except for two major systems in the body, except for your cardiovascular, pagdating po sa ating puso. Okay, although yes, nagkakaroon tayo ng orthostatic hypotension, weak peripheral pulses, steady, weak and irregular pulse. However, okay, what happens later on is that nagkakaroon po tayo dito ng increased, no, because your body now tries to compensate everything. Okay, so medyo the heart is the first one to respond actually. Okay, so when it comes to your potassium imbalance. Okay, so all are down except for your CV and tandaan po natin, and your UO. What is your UO? It's your urinary output. Okay? So, urinary output. So, tandaan po natin yan. All are down, pababa po lahat, except for your urine output. Okay? So, increase everything again and again and again, except for your urine output. Now, however, when it comes to your heart, okay? So, ito yung pinaka most commonly, no, na lumalabas actually sa boards. Okay? So I've seen this in one of our questions also in your PNLE. I think this has also been asked before. What are the positive or what are the possible ECG changes or EKG changes when it comes to your NCLEX? So that can be found in your hypokalemia. So the patient may experience, para mas madaling matandaan po natin. Okay, so I've made this one. I call it hypokalemia. Okay, hypokalemia. So this is now the problem or your ECG changes that may be or that may manifest in your patient. Okay, so hypokalemia. Okay, so in your hypokalemia STD, okay, in your hypokalemia STD, you need to remember this thing. Okay, so the U here, okay, the U here actually stands, this one stands for your U wave or your prominent U wave. Okay, none of any other condition actually gives us more prominent U wave other than your hypokalemia. In your hypokalemia, obviously po, okay, so napaka prominent po ng ating U wave. That's why it's one of the pathognomonic sign also of your hypokalemia to have a very, very prominent U wave. Okay, so tandaan natin yan. Another also, intendedly, I made this inverted T for us to remember that there is an inverted T wave. Okay, inverted T wave in your hypokalemia. Okay, so tandaan natin yan. These two most important thing. Okay, first is your prominent U wave, hypokalemia. Okay, and then your inverted T wave. So intendedly, inverted po yung ating pong mnemonic picture dito, no? So that we would be able to remember that in your hypokalemia, one of the ECG changes that might happen to your patient is the inverted T wave or the presence of the inverted T wave. Another also last one is here. I've also put here this one. Okay, this STD. Why? Because in your hypokalemia, there's also this what we call another ECG changes that may happen, which is your ST depression. Okay, your ST segment depression. So remember this one again. When it comes to your ECG changes, what will happen to your patient is magkakaroon ng prominent U wave, also your inverted T wave, and of course your ST depression. Okay, so these are the most important assessments or cues that should be taking down or taking note about in our patient. Okay, so let's go on further to your interventions. What are the possible interventions? Okay, and this is now the reckoning point, especially in your NCLEX. When it comes to NCLEX, really mas nakikialam po ang NCLEX talaga when it comes to interventions. So it's like when you are hypothetically already a nurse present on the bedside of the patient, what will you do? What is your first action based on the cues? Okay, it's always NCLEX question is always basing on the cues. That's why it's very important to take note of your cues. Okay, so now dito in your interventions, okay, so maybe we will be learning some new things or other things might be already known to us. However, this is just a sort of review. So first is, of course, you need to monitor the patient. Okay, monitor the patient holistically. Okay, monitor the cardiovascular status, the respiratory status, the neuromuscular, gastrointestinal, the renal status of the patient, and of course, okay, number 2, okay, place the patient on what? Place the patient, you write this down, place the patient in your cardiac monitor. Okay, cardiac monitor. Why? Because your patient is very now prone to your ECG changes, okay, which may lead, no, so without monitoring the ECG changes, so the patient is now very at risk of having these arrhythmias or not abnormal rhythm of the heart. It's because one of the major functions of your potassium is maintaining the normal pumping of the heart or the electrical activity of your heart muscle. Okay, so that's it. Okay, so you need to, of course, first monitor the patient. Number 2, place the patient in cardiac monitor. Okay, so number 3, another also intervention that we should be taking down here on our patient is, of course, we need to administer, you write this down, administer, okay, administer, okay, what are we going to administer? Oral potassium, okay, so we need to administer oral potassium. Okay, if the patient is able to consume or take oral potassium supplements, then we give oral potassium supplements to our patient. But we need to remember these few hints, which is very helpful to our NCLEX, both NCLEX and PNLE. Okay, first is that your oral potassium, okay, your oral potassium, you need to remember this one, that your oral potassium may cause, okay, it can cause your, okay, it can cause your nausea and vomiting. Okay, so your oral potassium can be or can cause or can lead to your nausea and vomiting. So the most important nursing consideration here is that ano po yung gagawin natin? Okay, ano yung gagawin natin? So now the most important nursing consideration is to take a meal. Okay, take a meal or a snack. Okay, so shortly saying, the patient cannot consume oral potassium, okay, with an empty stomach. Okay, they should not be taken on an empty stomach. So we need to remember this one. So sir, what if the patient complains of abdominal pain, distension, nausea, and vomiting, or gastrointestinal bleeding? So you need to discontinue the medication. Okay. Okay, another consideration as well. So there's also another form of your potassium, and this could be in your liquid potassium. Okay, my liquid potassium preparations din po. And we need to remember that in your liquid potassium chloride, okay, in your KCl, okay, so this one has an unpleasant taste. Okay, we need to remember this one. It has an unpleasant taste. So what will happen? Okay, or what is the best nursing action for this one to get rid of the unpleasant taste of your potassium chloride? So it has to be taken. Okay, it has to be taken with, okay, taken with juice or other liquid. So ito po yung ginagawa natin, no? So we need to take this one with a juice or another liquid. So we need to remember this one. Okay. So of course, another also is number 4 is when you have administered. So what we have discussed here is your oral potassium intake. But of course, we also need to remind our patient and administer to our patient, okay, IV potassium. Okay, again, IV potassium. But when it comes to your IV potassium, there's an important nursing consideration here, and I will be discussing this one on our next slide or next page. So number 5. Number 5 din po, okay, so we also need to put the patient, no, of course, always prioritize the patient safety. Why? Because the patient may experience now muscle weakness. It's because everything is down. Okay, so one of which is your weak, okay, neuromuscular system. So we need to remember that one. Okay, so if the patient is also taking a potassium losing diuretic like your thiazide diuretics. So again, your thiazide throws your potassium. So we need to discontinue that one. Okay, so number 6, discontinue intake. Okay, intake of your potassium wasting. Okay, potassium wasting diuretics. Okay, so again, when we say diuretics, so again, thiazide throws your potassium. Okay, so another thing that we need to put in mind also is number 7 is, of course, instruct the patient about foods, no? Okay, instruct, okay, food high in potassium. So the most common group of food, no, that are rich in potassium is, of course, we all know this one, avocado. Okay, suking-suki po ito sa boards. Avocado. We have also banana. Okay, ito very social din, lumalabas din to, no, spinach. Okay, and also ito, raisins, and many more, but these are the most common group of foods na palagi pong lumalabas at name-mention, no, when it comes to potassium rich group foods, okay, or good sources of your potassium. So now, as promised, I will be expanding the discussion on your taking of your potassium via IV route. Okay, so again, let's have a more comprehensive discussion on the intravenous administration of your potassium, because this should be highlighted. Okay, so now potassium is never given. Okay, remember that potassium is never given via IV push or by the intramuscular or subcutaneous route. Again, okay, number 1, of course, the most important nursing consideration here is that potassium, okay, is never given, okay, never given via IV push. Okay, so what does it mean? You can't be directly administering the potassium, okay, directly to the blood vessels of your patient. It may kill your patient. Okay, neither, okay, your sub-Q and also your IM route. Okay, it's a no-no. Again, it's a no-no to give your IV push, sub-Q, or even your IM. Why? Because it might kill your patient. Okay, so how do we do it? You dilute. Okay, again, you dilute the potassium, or you dilute the potassium. Okay, so a dilution of no more than 1 milliequivalent in every 10 ml of your potassium is recommended. Okay, so how do we do it? Of course, sinabi ko na. So what do? We dilute the potassium. So how do we dilute it? So in every 1 milliequivalent of your potassium, so we dilute it to 10 liters. Okay, so rather 10 ml. Okay, so in every 1 milliequivalent, so we dilute it to your 10 ml of your any solution. It could be your sterile water or your any diluent. Okay, that's prescribed by your doctor or your primary healthcare provider in the case of NCLEX. So also you need to ensure that the IV bag containing potassium is properly labeled, and that's a standard as well in your medication, okay, in your drug administration. And also, so we need to remember this one, that your potassium, okay, another consideration, that your potassium infusion, okay, potassium infusion, which may be used, no, or which may be administered through an infusion pump. Okay, so IV infusion can cause your phlebitis. Okay, So, tandaan po natin na it can cause an inflammation to the IV site. So, kapag nagkaroon po tayo ng sign ng phlebitis or infiltration, okay? So, if meron po tayong sign ng phlebitis or infiltration, okay? So, we need to stop immediately. So, stop if meron po tayo dito. Okay? So, stop immediately the administration of your potassium. Okay? So, another thing is that the nurse should assess for renal function. Okay? Assess for renal function. Okay? Assess for renal function. Okay? Assess for renal function of your patient. Okay? So, we need to look at the renal function of the patient and monitor intake and output of your patient, okay, during your administration. So this is the most important nursing consideration that we should be taking note about the administration of your potassium via IV route. Okay, so that's it for your hypokalemia concept, and of course we will be having a separate discussion on your hyperkalemia. Thank you so much.